Welcome. Glad to have everybody with us here today. Today is going to be a fantastic webinar talking about healthcare specifically and how we can optimize our experience for patients. Brief overview, I am Stanton Smith. I'm VP of our CX Tech Consulting and Customer Success here at InflowCX. Very high level about Inflow. We're a services and consulting firm specializing in CX technology. So by that, I mean anything related to your customer experience, the contact center, the unified communications, and all the ancillary technologies that help support that, whether it's the workforce management, AI, quality, really everything that helps enable companies to provide an optimal experience for their customers, for their patients. That's what we focus on. With us, we've got Kate and Ronnie, who I'll allow to introduce themselves. Kate, why don't you go first?
Thanks, Stanton. Hi, everyone. Kate Doherty. I'm a senior solutions engineer here at InflowCX. I've been in the contact center space for 24 years. I spent the first few years as an agent, but the majority really as an engineer. I've been in the partner space for about 2 years here with Inflow, and I spent 10 years at Providence as an enterprise telephony engineer. My role at Providence was really focused on the patient and caregiver experiences. It was really important to me that they be able to connect with caregivers that patients needed to get in touch with, and that the technologies that we were putting in place didn't get in the way of caregivers being able to provide care, right? So healthcare is a subject that's very near and dear to my heart.
Thank you. Ronnie?
Hey, thanks, Stanton. Happy to be here today. I'm the Senior Healthcare Marketing Manager for Five9 that helps our team enable and empower our sales team to do healthcare. It is our largest vertical at Five9. My background, I've been around forever in IT. I used to sell Cisco hardware with a VAR, and I mainly worked in the federal space. So I did a lot with the VA, with military health, Indian health, and then I moved into the private sector and interactive patient care, and walked a lot of floors, so I understand the complexity of communications in the patient journey. And for those who may not be familiar with Five9, we offer a HIPAA-compliant cloud contact center solution that healthcare organizations can utilize to seamlessly monitor and report their call volumes in real time across critical areas like patient access, scheduling, prescription refills, and rev cycle management. And we leverage AI for improved outcomes and business success. We integrate with back-end EHR systems, and we can act as a central hub for digital engagement, both inside and outside the health system.
Fantastic. Thank you. So let's jump in. Kate, I want to start by asking you, obviously, patient satisfaction is critically important in healthcare. What role does communication play in that?
Yeah, great question, Stanton. So patient satisfaction is directly tied to experience. I feel like that's a no-brainer statement, but yet it's actually not, right? It's essential to provide an individualized and meaningful experience to each patient, but not just at the bedside, not just with the clinicians, but with every employee that patients interact with. And that really includes contact center agents and each of the channels that an organization intends to use: voice, text, social media, chat, and email, right? Patients are consumers of healthcare nowadays. They have choices, just like you and me and Ronnie, we have choices with the retailers that we do business with. It's no secret that I'm a huge fan of REI because of my experiences with them and the experiences that they craft for me. When I'm not simply shopping and I actually have to reach out for support, I can do it on my terms. They know me from the minute that I arrive, my demographic information to my most recent product purchases or my support requests. I'm loyal to REI and fully acknowledge that I'm willing to pay a little bit more because of the amazing end-to-end experiences that they craft for me. They're consumer, right? Healthcare orgs can have great greeters and wayfinding assistants in a hospital. But if patients spend 25 minutes on the phone to schedule an appointment, or if they can't make a prescription renewal in a way that makes sense to them, it's not a good experience for them. And experiences like that negate the great care that happens in the clinical setting. So health systems really need to think about the patient experience holistically from end to end, including the contact center as one of those front doors.
That's a great point, because when somebody does have a negative experience, even if they've got years of prior positive experience, they can really be impactful. So, Ronnie, I'd like to ask you then, how does Five9 help with that patient satisfaction?
Yeah, well, like Kate said, patients are consumers, but these days healthcare has to provide more care with less staff. COVID has decimated the healthcare delivery system, and burnout is real. There are more providers and nurses exiting the workforce every day than are coming into it. And then compile that with an aging population and inflation and these other issues, and it's a real crisis. So how do you enhance the patient experience with less? Well, we have to include automation in the solution. We have to take redundant, repetitive, and menial tasks away from our agents. We have to take time-wasting activities out of the workflows. And we have to make data more easily and readily able to consume. We have to keep the clinical staff working at the top of their license and remove everything else off their plate if we can. And if we can do that, we can lead to a happier workforce and thus a happier patient experience. So looking at it from more of the internal side, as Kate was looking at it from like the external side.
Perfect. So how then, in doing more with less, talking about making that data available, as we're developing our strategy with patients, let's talk about the timing of that. When do you communicate and how do you communicate? What options do you allow patients to have when they're interacting with you?
Well, I'll start. I think there are 3 ways to think about your communication strategy. One is omni-channel. Today you got to give people the many options that they want to connect with you so they can pick their channel of choice. And by omni-channel, I mean not only voice, but text, email, web chat, or the combination of all of them. If you don't do this, your competition is only 1 click away. And I think that's what everybody's starting to realize. 24/7 by 365 availability is another way. Provide the ability for them to pick when they want to communicate with you, and that could be around the clock during the off hours. And then finally, I think self-service. Give the people the option to self-serve for those who want it. People are consumers before they become patients. They are quietly researching you, and self-service allows them to be in control of how they get and receive information from you by staying under the radar and behind their computer screen, which is what the younger generation likes to do.
Yeah, and if I can just sort of tack onto that, right? Ronnie just concluded with the younger generation, right? Let's talk about the older generation too, right? Healthcare has an aging population. It has the most diverse population, right? Ranging from those that are just born all the way through those that have lived a really long life and everybody else in between, right? So each of those generations, kind of to Ronnie's point, has a different preference on how they want to connect with healthcare organizations and what data is then available to them on that chosen communication method, right? And we, again, sort of thinking about it from a holistic perspective. Do you really want your patients to spend 10 to 20 minutes with an agent to collect a $20 payment? Healthcare organizations don't, right? And neither does the patient, which is why that digital first approach is being driven by the patients and their desire to self-serve, right? I can use my phone to order virtually anything. And I'm sad to say that Amazon probably knows more about me than my own care team, right? Digital paths, online portals, mobile apps, IVR speech applications can provide patients with those abilities to self-serve, and everything from payments, prescription refills, appointment scheduling, some demographic changes can be handled by virtual agents and bots, right? Equipping patients with the ability to self-service their needs, again, to Ronnie's point, frees up staff for those more complex interactions and empowers the patient to manage portions of their care on their terms, on their schedule. Ronnie, I think that you recently collected data on the topic of self-service, right?
Yes. So thank you for the lead in. Yes, I did recently go and do research on all our healthcare clients that are using Five9 virtual agents, or what we call intelligent virtual agents, or IVAs. I wanted to know why they bought them, what pain was it solving, did it solve for the pain, and then how do they know? What was the criteria of success that they used? And then were there any lessons learned because of it? And our results from this data has been published recently in this e-guide that's on our website called How AI Drives Value in Healthcare Communication. We just published it in June. Feel free to download it. Included in this e-guide is also a basic roadmap on how you can plan a project around deploying virtual agents. The point of the e-guide is to tell the healthcare community that, hey, the water's fine. Many are already using AI technology to assist their call center agents, and they're seeing some pretty great results. The interesting part is that many of our clients had different criteria of success measurement. Reducing, or saving money or reducing labor costs was some of them, obviously super important, but there was also just reducing patient frustration. That was a definite criteria of success in some of these cases.
So, yeah, we've covered a lot around why that patient experience is important, and tips on cultivating that communication strategy. If I were a healthcare professional, and Kate, I'll start with you, and I came to you and said, "Hey, give me some of the key, most impactful best practices out there that I should be implementing into my contact center," what would you answer?
Yeah, that's a great question, Stanton. And I think it's sort of multifaceted, if you will. I think the place where I start from a best practice is that it needs to be a holistic view of the patient experience, right? You've heard Ronnie and I talk about the fact that it's imperative for patients to be able to use their channel of choice to connect with their provider. We've talked about self-service a lot, but what we also need to talk about is that there has to be a human element in healthcare, right? Because the human element is still at the core, even with the advancements in digital communications and self-service. There's still an immense need for that human interaction. So, Ronnie and I have talked about areas where we can sort of allow the patient to do some self-service. At the same time, while we're doing that, we want to be able to ensure areas where they can still get that human connection, right? I mean, there's studies that show that patients who are experiencing financial hardship, if they're paired with a personal financial coach, the impact is profound, right? Bad debt and financial write-offs decrease significantly. By creating a human connection, that billing recovery, it's more effective and it's more compassionate, right? Use automation where it makes sense to free up resources for other things, right? Use automation where we can still bring in a human element, right? Outbound campaigns, right? Can be really useful to proactively connect with patients for lots of reasons, right? Reminders that their payment is due, prescription refills need to be refilled or picked up, and of course, appointment reminders. But what if we took it a step farther and we used it in an actual care model, right? A care plan campaign centered around patients who are scheduled for their first chemo treatment, right? A communication can be placed to remind the patient to pack their chemo tote or their self-care bag with things that might get lost in the shuffle when feeling the stresses of a first chemo treatment. Things like warm socks, nausea meds, a favorite water bottle, a blanket, right? Those items of comfort. The campaign allows a meaningful connection to the patient using a proactive approach. But of course, we want to allow the patient to escalate out to an agent if needed. And this is a prime area where a patient might actually want to speak to a care team resource. So keeping that human touch is a focus, I think, is absolutely one best practice. And then one final note that can't be overlooked are the systems, right? Integrating your systems, the contact center systems, and the EMR back office systems of record. They have to be integrated at all levels of an organization, especially for the contact center, right? I've mentioned REI and they know everything about me, whether I'm in the store or I'm talking or chatting with the contact center agents. They know more about me than my doctor does because the systems are integrated for every employee that I come across in my journey. So integrating systems is critical to ensuring the success of all of this and crafting these amazing experiences that Ronnie and I are talking about for patients and caregivers.
No, thank you for that. So then, Ronnie, I'd pivot to you then. Now that Kate's given me best practices that I should utilize, can you provide me with some use cases, examples or workflows within Five9 that help me accomplish what Kate just outlined for us?
Yes, so thank you. So I mentioned omni-channel earlier, and we can take it a step further and look at this diagram as an example of how these channels can be used to provide a more patient-centric experience in the health system. Can you pull up the slide that I got, Kelly? Okay, great, thank you. So most calls that come in to a health system are primarily for two reasons: making appointments and refilling prescriptions. So if we use making an appointment as an example, you can see the many channels that a patient can use to communicate with their provider. Phone, of course, is the legacy choice, which includes mobile phones now too. But there's also email, SMS texting, web chat, social media, and video, or a combination of all of them together. So if an appointment is the objective here, we want to make it as easy as possible for them to do that. On the first call, we need to authenticate them, then get information from them like who they want to see and get their dates and time preferences. We'll get that scheduled, then we want to send up follow-up reminders and then confirm the appointment. Make it easy for them to reschedule or cancel if needed too. And then finally, like Kate said, prepare them for when the appointment time comes, where to park, door to entry, etc., like that. Now that seems simple, right? Well, it's not simple, as many people can attest to today. And that's just for one appointment. Communication is a continuous process, and the trick is to communicate at the right time with the right party and the right information. Now, as a parent, I'm always over communicating to my kids, but if they aren't listening, I'm just talking into space. Like I use the story that I usually remind my son to make sure he puts his homework in his backpack after dinner. And then I remind him again before he goes to bed. Now, these time periods happen to be convenient for me to do the reminding for him, but it's not necessarily when he has his ears on. The best time for him to proactively listen to me is just before he leaves for school in the morning, on his terms, when he's actually the most receptive to listening to me. And I think all parents know when they're listening and when they're not, right? So translate that to healthcare, where we want to build workflows around communication agendas that are going to be most effective. Now go to the next slide, please. The trick is to do it on the patient channel of choice and when they are most receptive to consuming the information. So that's where AI automation and analytics come in. These tools can distill all the communication data points in the patient's call history and their call journey and provide the best path to personalize their communication stream on their terms for hopefully a more successful outcome. It's never a good idea to reach a patient when they're not feeling well, right? Because they're just not feeling well. You basically want to talk to their caregiver in those cases, right? So those are the things of the analytics that'll help with that. One key takeaway is that voice will never go away, at least not in healthcare. You can provide these other communication options to patients, members, and customers, but if there's still a large percentage of calls that'll end with, oh, I have another question. Can I speak to somebody about my bill, my test result, a side effect I just experienced, etc. And that is a big difference between the healthcare industry and other industries, like retail or finance. If you can't transfer that existing digital engagement to a voice channel when required, your patient satisfaction level is going to go down. And some of these point products that are out there don't have a mechanism to connect to the voice channel when required. Well, but 5.9 does, and working with Inflow, we can show you how.
That's fantastic. Thank you. I do want to leave time for some Q&A today. But there's been a plethora of information here. So anybody either attending or watching later, please reach out. As you have questions, as you want to engage in these conversations, engage Ronnie or Kate or myself, anybody, really, and we'd love to have that conversation with you. So let's jump over to some Q&A. What questions do we have from our audience here? And while we wait, I suppose I could ask one. Ronnie, earlier you mentioned some ROI metrics. What do you have to share with the audience around that? Anything specific of benchmarks that you've seen within this space?
Yes, so thank you. We do have as I mentioned earlier, the newly published e-guide, How AI Drives Value in Healthcare Communication, has several of the ROIs mentioned that healthcare systems have gained from using virtual agent. But one that comes to mind right now is a provider with a bunch of clinics that have been deflecting 35% of their call volume per month and reducing voicemail by over 50% using IVA technology. They were experiencing, because they were multi-hatted and could be rooming patients, they weren't all sitting at the desk all the time, and they didn't want to miss those calls. So the virtual agent was very proactive in being able to do that and contain some calls that didn't need to be touched by a human. And that's really helped their patient satisfaction scores a lot. What I do see is a minimum of at least 10 to 20% call containment with IVA, typically greater, but it is resulting in large labor savings, which is increasing patient satisfaction too. So, and you can help normalize your call volume spikes, you know, like Mondays typically are busier days or open enrollment stuff. So IVAs can help normalize your staffing. That's what I've been seeing.
Yeah, that's a great call out too, because it's not a solution that you just lay out across the board, but it can be adaptable depending on even seasonality within the week or within the day, let alone the year. Yeah, that's great. I saw somebody's hand go up and then go back down. Don't know if that's an audience question or not. Okay. Well, I do want to thank both of you for taking the time with me today, and thank you to our audience as well for attending. Hopefully, the takeaways from everybody have been valuable. And like I said before, please engage. We'd love to have these conversations with you and help make your healthcare experience the best that it can be for your patients.
Thank you for letting me be here, a part of your webinar today.
All right. Thanks, everyone. Take care.
Thanks, everyone.